The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar topic today is Relationships and Brain Tumors. My name is Umbreen Maan, Program Manager here at the ABTA, and I'm delighted to introduce our speaker for the day. Melanie Cavazos earned a bachelor's degree and master's degree in social work from the University of Texas at Austin and is a licensed clinical social worker. She has experience in providing individual, couples, and family counseling, as well as facilitated groups for patients, caregivers, and grief support. Since 2015, Melanie has worked at MD Anderson Cancer Center, where she provides psychosocial support and counseling services to patients and families. Melanie works in the West Houston area location campus and is an integral part of the interdisciplinary team consisting of medical assistants, nurses, nurse practitioners, and physicians. Thank you for joining us, Melanie. You may now begin your presentation.
Thank you very much, Umbreen, and welcome to everybody who is joining us today. Thank you to the American Brain Tumor Association for inviting me to speak on this topic. We'll go ahead and get started. So first off, I have no disclosures to share. The topic today is relationships and brain tumors. It's something that I am very passionate about. Like Umbreen said, I work at MD Anderson Cancer Center. So a lot of my experience is cancer specific, but this presentation is going to be tailored to both benign tumors and malignant tumors. So it should be able to be relevant to everybody here today. So the objectives for our presentation are to recognize the physical, social, and emotional effects that treatment has on you and your relationships, understand how to manage psychosocial side effects and communicate these changes with your loved ones and your clinicians, and to learn tips on how to communicate with children about the diagnosis. So a diagnosis of a brain tumor can throw a family system off balance and often requires role changes for both the patient and their family members. It's often said this disease is not only something that affects the patient, it affects everybody involved in their life. So let's talk a little bit about coping and the adjustment to the diagnosis. You may experience a variety of new feelings, and these feelings can be experienced by both the patient and the caregiver and loved ones involved. These feelings occur throughout the disease trajectory. They can occur at time of diagnosis, they can occur during treatment, they can occur during recovery and maintenance phases as well. So you may experience increased anxiety, you may feel angry, you may experience some guilt, some sadness and depression, confusion, asking why me? Why is this happening? Along with those emotional aspects, you can also have stress related to financial concerns. So a lot of times with a brain tumor diagnosis, you may have to stop working, and that can create a loss of income for the family. You can have increased medical and insurance costs. Even with great health insurance, bills can pile up from the hospitals and the treatments. You may also have travel-related costs. So you may live in an area that you can't receive treatment. You may have to travel in order to receive the specialized care that you need. So those costs can include lodging, transportation, meals, and all of these can add stress to a family system when you have increased cost and decreased income. It can also affect your relationships. So a brain tumor can affect your marriage. It can affect your partnership if you're not married. It can affect relationships with parents, relationships with children, relationships with friends. It can cause increased difficulties in familial conflict. Some of these are due to role changes that you may experience due to the diagnosis. The diagnosis may also create intimacy issues that can cause stress on a relationship. We're going to talk later in the presentation about children's coping and how that is affected by a diagnosis. And then in how you involve your extended family in this diagnosis, how that can be helpful, how it can also create more stress for the family and more discord in your relationships. One of the major causes of marital discord or familial conflict is role changes that are associated with a diagnosis. So as the patient, you may lose the ability to fulfill previous roles. You may lack independence. And these things can kind of come and go. They can wax and wane throughout the disease trajectory. As caregivers, you can experience role changes as well. You may have increased responsibilities. You may feel that your role has shifted from a partnership, an intimate relationship, to more of a caretaker role. The sole provider of the family, if they're the ones who are diagnosed with the brain tumor, they may not be able to work as much, or they may not be able to work at all. And then they lose that role of being that financial and sole provider for the family. If someone is used to maybe staying home and taking care of the kids, and they're the ones diagnosed with the brain tumor, they may not be able to care for those children in the same way. And so they lose that role. And all of these roles make up our identities. So losing those roles, experiencing those role changes can create stress. You can experience sadness and anger, all those things we discussed at the beginning, because you're not able to have that identity anymore. So how do you cope with those changes? First, you have to allow time. It takes time to adjust. You have to allow time for both people in the relationship to get used to those changes in the roles, particularly if your roles have reversed. So if you were the sole provider and now you are the one at home and your partner has now had to go back to work, maybe you need the income, you need the health insurance. That role reversal, it's going to take time for you to get used to and for you to adjust to it. Second, you need to listen to each other's needs and find ways to meet them. So you want to be able to talk to each other about, how are you doing with this role change? What do you need from me? You know, if you're the one who always paid the bills, and maybe due to some confusion or some memory issues, you're not able to do that anymore, and your partner's the one who's taking that over, ask them what they need from you. Maybe they need you to tell them where you keep the bills. Something as simple as, this is how you access the bank account. But you need to listen to each other and find ways to meet those needs. Ties into number 3, which is to talk about the changes in order to avoid any misunderstandings. You'll see throughout this presentation, communication is a huge piece of how you continue your relationships and how you continue to work with them and make sure that they stay steady for you. Number 4, you may need to grieve the loss. You may need to grieve the loss of that role that you used to hold. And that may be something you need to do individually. It may be something that you want to talk to your partner about. But each of you may have lost something in that, and you need to allow yourself to grieve that loss. You want to explore new opportunities to connect. So you may have changed roles. Some things may have reversed. You may not be able to connect in the way that you used to. So you need to explore new ways to connect with each other, whether that's engaging in a new activity together, taking up a new hobby, setting aside time to spend with each other so that you can just connect again and not get lost in everything that's happening. And then 6, commit to a higher purpose in your relationship. Acknowledge that things have changed and commit to maintaining that relationship and realizing that that relationship is going to continue to change and evolve, and committing to that higher purpose. So you may also feel some anticipatory grief, and that can be for both patients and for their loved ones. Anticipatory grief is feelings of sadness and sometimes anxiety related to the fear of death. They have a lot of the same symptoms as conventional or traditional grief. So you may experience denial, anger, bargaining, depression, and acceptance. But this anticipatory grief is not only related to the fear of dying, but you can also experience grief related to other potential losses. So for example, if you are the patient, you may experience anticipatory grief for the loss of your abilities, the loss of your cognition, your memory, other personality traits. Brain tumors can cause memory issues. They can cause changes in personality. And those things are things that you may grieve, not only as the patient, but the caregiver can grieve those things as well. The loss of stability and security, the loss of one's independence, and the loss of a sense of normalcy. Once you receive that brain tumor diagnosis, nothing remains the same, right? Everything changes. And that loss of your normalcy, your normal routine, what you imagined your life and relationships to look like, you are going to experience some anticipatory grief and grieve those losses as well. So let's talk specifically about the caregivers. Caregivers can experience what we call caregiver burden, caregiver fatigue. It's when a caregiver feels overwhelmed by the negative impacts that caregiving can have. You may be experiencing chronic stress. You have multiple competing priorities. So you may, as the caregiver, be in charge of having a job, but also taking care of your loved one. You may have to worry about paying bills. You may have to worry about staying home so that your loved one is not alone. You're going to have multiple competing priorities, which lead and increase that stress. And when that stress level becomes overwhelming is when you start experiencing that caregiver burden or caregiver fatigue. Those feelings can eventually lead to feelings of resentment. And when resentment enters the relationship, it takes a lot of effort to be able to come back from that. So how do you decrease your caregiver burden or your caregiver fatigue? Here's one of those buzzwords. You're going to prioritize your self-care. As the caregiver, you tend to focus solely on the patient and what the patient needs. You prioritize them and you prioritize what they need. You need to prioritize yourself as well. Take a break. Involve your support system, whether that's your informal supports, so your family, your friends, your neighbors, or whether it's a formal support system by hiring a private caregiver, looking into respite care, adult day centers, home health care, but allowing yourself to prioritize time to take care of yourself by finding other people who can help you take care of the patient, giving yourself that time to recharge. Communication again, communicate your needs openly and directly to the patient. A lot of times I hear from caregivers that they're worried about talking to their loved ones about what they need because they feel guilty that they need something when their loved one is dealing with a diagnosis of a brain tumor. But the pillar of a good relationship is communication. You have to discuss what you need. And by discussing what you need and prioritizing yourself, you're better able to take care of your loved one. The dangers of caregiver burden and fatigue are that you become so overwhelmed that maybe you get sick yourself because of chronic stress, and then you're not able to care for your loved one. So we want to make sure that when you start experiencing some of these feelings, you recognize them and you ask for help. A lot of times I get questions about, how do I involve these support systems? Maybe I realize that I need help, but I don't know where to turn, and I don't know who to ask and who to involve. Organize a family meeting. In the times right now of COVID, I know that makes things a little bit more difficult. So if you can't get everybody together in one place, then use Skype, FaceTime, conference call, email chain, whatever it is to involve your family. You want to divide tasks and divide them appropriately. So in order for this really to work, each family member needs to have input into their division of tasks. They have to fit both the family needs and the patient's needs, and they need to be divided evenly. List each task for each person or each agency responsible, so there's no question as to who agreed to do what. And to be flexible. The changing needs of the patient and the changing demands of the family are ongoing. So things are going to be ever evolving, and you may need to have multiple family meetings so that you can reassess the situation and determine what it is that's needed. And then always have a plan B. So what are some of the things that you can ask for help on? Let's talk about, the vital needs of a patient. So food, organizing a meal delivery service, getting people to donate meals, getting people to deliver meals so that it's one less thing that the family needs to worry about. Finances. Maybe you are struggling financially and you can involve some of your informal supports to either donate money or donate their time so that you don't have to spend money on hiring caregivers, which relates to safety. So if as the patient, you're not able to be alone for long periods of time, having someone sign up for periods of time to come sit with you, to provide you that social support, but also to ensure your safety. Medical appointments. I can imagine that you have a lot of medical appointments. Transportation to those appointments can become troublesome, especially if you're not able to drive yourself anymore and your spouse or your partner is having to work. Then finding people who can help drive you to those appointments. So we want to look at who in your informal support system has the time to help you with these things and has the financial ability to help you, whether it's paying for meals, paying for transportation, or they have the time to do it themselves. And here are a few places that you can look. So if you're wondering, where do I go? Who are these people that I ask for help? Start with your extended family. And don't think that these family members need to live close by. There are a lot of things that family can do for you from far away as well. Friends, neighbors, if you have a place of worship, is a good support for you. And a lot of those church members would be willing to help and to do things for you. And then home care agencies. If you don't have those informal supports that you can lean on, then you can look for those more formal supports and actually hiring the professional to be able to come and to help you do some of these tasks as well. So the next step that I want to talk about is resilience. So we talked about what things you can experience that are going to potentially create stress for you as a patient, for you as a caregiver, and for your relationship together. We talked about emotions that you may have, financial stress, difficulties communicating with each other. And what I want to talk about now is resilience. So resilience is defined as the act of rebounding or springing back after being stretched or pressed, or recovering strength, spirit, and good humor. Unpredicted or markedly successful adaptations to negative life events, trauma, stress, and other forms of risk. It encompasses not merely surviving, but both thriving and having benefited from the stressful experience. So I think we can all agree that being diagnosed with a brain tumor is a negative, stressful life event. It could also be defined as a trauma. It creates stress. And resilience is what rebounds you from that stress to where you're not just surviving, but you're thriving and you have found a benefit from that stressful experience. Resilience is how you cope with this diagnosis. So there's a few areas of resilience that we'll talk about. Social engagement, self-awareness and self-care, attention and focus, and finding meaning. And when I'm talking about resilience, I'm talking both about patients and caregivers and their resilience. So social engagement is the ability to cultivate social connections and avoid social isolation. As I'm sure most of you have noticed, a diagnosis of a brain tumor is isolating. It's not something that is very common. You're not going to be able to go out and do all of the social activities that you used to do. You may not feel physically well enough to do that. You may not feel emotionally well enough to do that. And all of those things can create an isolating experience. So how do we avoid that social isolation? Get involved in some activities. Volunteer in your community. Show appreciation of others. Be an active listener. Random acts of kindness. And I know during COVID it's hard, but unplug and meet people, right? And now during COVID, you might have to plug in and meet people. So you might have to find virtual support groups that you can join, Facebook groups or whatever it is for that to meet new people, might be virtual now. But whatever it is, you want to be able to find those social connections. The second piece of resilience is self-awareness and self-care. So self-awareness is defined as the capacity to understand your own strengths, weaknesses, emotions, values, natural inclinations, tendencies, and motivation. And self-care are those behaviors, thoughts, and attitudes that maintain our overall well-being and personal health. There's three areas of self-care. There's physical self-care, emotional and psychological self-care, and spiritual self-care. So how do we have self-awareness and how do we engage in self-care? Here's a few activities that you can look at. And these activities will help you both in the physical and the emotional and the spiritual. You have to take care of your physical self, right? You have to exercise regularly, eat well, get plenty of sleep. And then for your psychological self-care, identify those emotions that you're feeling. Practice in journaling, use some meditation, join a support group, engage in counseling, spend time in nature. If you're a spiritual person, engage in that spirituality, whether it's by yourself or in a place of worship. And the other piece of resilience is the attention and focus, to tune out that irrelevant information and the perceptions in order to focus on what is important, what information is important. And activities that can help you with your attention and your focus are mindfulness, deep breathing exercises, guided imagery, and meditation. And last, it's finding meaning. So when we were on that slide about resilience, it said, you're not only surviving, but you're thriving, and you found benefit from your stressful experience. So the act of making sense of this experience and determining the significance of that experience, finding meaning and benefit in your diagnosis or in your loved one's diagnosis. How do you do that? Make realistic short and long-term goals and work towards them. If there are things that you have wanted to do, but that you've put off doing for some reason, and you now have time to do it, make those goals and work towards them. Find a benefit in what has happened. Embrace the changes in your life. Like we said before, your normal is not there anymore. So embrace those changes. Find benefits in those changes. They're not all going to be good. They're not all going to be bad. And then find a sense of purpose. Find a sense of purpose in your life. So what happens if you can't find that resilient spirit that you have, and you feel like you can't do it on your own and you really need some help? Well, there's good news, because there is help readily available for you. And there's help in a lot of different avenues. So, and this goes for patients and caregivers alike. Find support, seek support, whether it's in a support group, online support communities, one-on-one peer support. You know, there are a lot of patient matching programs and caregiver matching programs that you can be connected one-on-one to a peer support. Talk with your family and friends. If you're comfortable sharing with them how you're feeling, a lot of times just discussing it out loud, getting it out is helpful. Educate yourself. There are so many different ways that you can find education on what you're experiencing. Look into different things. Educate yourself on different techniques like meditation or relaxation. If you've never done those exercises before, there's a lot of resources out there for you. And maybe some of these informal supports are not enough for you, and that's fine, because we have formal supports out there for you as well. Engage in formal counseling, whether it's individual, as a couple, as a family. There are licensed counselors that you can find that are doing virtual counseling right now. I'm sure there's licensed counselors that your medical teams can connect you with, but engage in that formal support if you realize that you need a little bit more. And your spiritual supports. So if you're a spiritual person, again, go find those spiritual leaders that you can connect with and that you can talk to. And as we said before, maintain your physical health. That's important as well. Exercise, healthy eating, taking care of yourself medically. And speaking about taking care of yourself medically, a lot of times I get questions about, how do I communicate with my medical team? Or patients will come to me and say, you know, I just had this visit and I didn't get any of my questions answered, or I didn't feel like I got a chance to really talk about how I'm doing. So here are a few tips for you on communicating effectively with your medical team. Prepare questions ahead of your appointment. And now I know because of COVID, a lot of visitor restrictions are happening. You may be attending some of these appointments on your own. I would definitely encourage you, if you do have to go on your own, to have a family member or your partner on the phone so that they can be involved. They can hear everything as well. Designate a point person in charge of communicating with the team. It may not be you as the patient, which is okay. If you have someone that's better at that, designate one person so that the medical team is not having to communicate with 5 of your family members. Designate one person, and then you'll get the most effective communication. Take notes. Ask if you can record audio of the appointment. A lot of times, so much information is being thrown at you that you may not remember everything that's discussed. So by taking notes or recording that audio, then you can go back when you're at a more peaceful and calm time and listen to all of it again. Request clarification if needed. Ask questions. Stop the doctor and say, I didn't understand that. Can you explain it further? And then clarify with your team too, how do they prefer for you to communicate questions or concerns in between appointments? Do they have an electronic health record that they would like for you to send messages to? Do they prefer phone calls or emails? Clarify with them their preference, and then also express your preference. And hopefully they align, but if not, then you can have a conversation about that. And then our objective is, how are children going to cope with this diagnosis? If you have children, you may be wondering, what do I do? What do I tell them? What do I be on the lookout for? So we're going to talk about that for a little bit. A parent's brain tumor or a cancer diagnosis is going to affect your child, whether or not that child is informed of the condition. And it has been shown that anxiety levels are higher in children who aren't informed about their parent's condition compared to children where the issue is discussed. So we always encourage you to discuss with your children what is going on about your diagnosis and your treatment. And we'll talk a little bit about how to do that in an age-appropriate way. So here are some things to consider when you're having a family conversation about a new diagnosis, or maybe you're having a discussion about a new treatment that's going to be offered. We want to use age-appropriate language, which I have some slides on developmental stages. We want to validate whatever it is that your child is feeling, and model naming emotions. Children are not great at naming what emotion they're feeling. So as the parent, you want to model that for them and say to them, when I heard this, I felt sad or I felt scared. Encourage them to practice naming their emotions as well. Monitor their reactions, and that needs to be ongoing. So these reactions may not occur during this initial conversation. It may be something that you see come up in the next coming weeks. So monitor those reactions and have other people monitor them as well. Inform the child's school of what's going on. So teachers and counselors at the school can monitor that. If they go to an after-school program or are involved in any extracurricular activities, involve those parents and leaders as well. Allow time for questions. Let them ask you what they're concerned about. And consider the timing of when you have these conversations. You don't want to have a conversation when you need to leave the house in 10 minutes to get somewhere. You want to be able to make sure you have the time set aside that you can spend as much time as needed. And then be aware of your child's developmental stage, which we'll talk about. So depending on your child's age and their developmental stage, it's going to tailor how you're going to discuss this diagnosis and what reactions you may experience and what you may see with them. In infancy, as you can imagine, little awareness of what's going on. They will probably be aware of separation from their parents. If you're not around because you have to be at the doctor, you're not around because you're not feeling well. That's something that an infant will notice. They might be fussier, clingier. The best thing you can do at that stage is to maintain their schedule, maintain their routine, and provide ample physical contact. Early childhood is defined between age 3 and 6. So they have a small degree of understanding of the illness, but they're experiencing what's known as magical thinking. So they perceive illness as a punishment for being bad. And a lot of times you'll hear kids this age think that they did something to cause their parent to become ill. You know, they didn't listen to mom when she told them to clean their room. And this is a punishment for that. Reactions they may have: nightmares, bedwetting, regressions. You might notice a little bit more aggression from somebody, hyperactivity, lots of energy. And how do you respond as a parent? You want to explain to them, discuss the tumor, use props, talk to them, use pictures, use dolls, use stuffed animals, try to explain it to them, and then include them in helping with your care in age-appropriate ways. So a child, between the ages of 3 and 6 is not going to be able to help you substantially, but you can find small tasks for them to be able to do so that they feel involved in your care. Middle childhood, between 7 and 12, better able to describe their feelings. Logical reasoning begins, so they're not experiencing that magical thinking anymore. They're more interested in details, more interested in the whys. And you may notice more physical complaints from a child this age. May have stomach aches, headaches, those somatic experiences. They may have new fears, new emotions that they're not able to describe to you. And so as the parent, you want to ask them about their thoughts and emotions, really get them to start naming them, to start discussing them with you. And then one of the most difficult things to do is, even if your children don't bring it up, is to address the issue of the parent dying. Children of that age understand death, and whether they bring it up to you or not, most likely they have had that thought and they're concerned about it. So you want to make sure you bring it up to them. Now, adolescents, 13 to 18, they're able to communicate with you on a higher level. They have abstract thinking skills. They may be struggling to find meaning. We talked about finding meaning and benefit in your disease. Teenagers are probably going to be struggling to find that meaning. Some reactions: they may try to take on a more parental role, take on more responsibilities, attempt to control their emotions and reactions, experiencing more guilt. If they want to go hang out with their friends, they may experience guilt by leaving and not spending time with you. So as the parent, how do you respond to that? You provide details, you discuss how they want their information given to them, and then you encourage them to confide in someone, whether it's you or not, but encourage them to find a trusting adult that they can confide in and they can talk to about how they're feeling. This is something that we talk about when I'm talking to kids about how they're coping with their parents' diagnosis. Feeling facts. Everybody feels something all of the time. And sometimes people have mixed feelings. All feelings are okay. Now, I know some of you may have been brought up with there are positive feelings and negative feelings. We don't identify them that way. All feelings are okay, although some are more difficult to have. Some are harder to experience. They need to be expressed, and we're only responsible for our own feelings, and we cannot change other people's feelings. Anger is a feeling that a lot of kids will have. And so how do you help someone cope with anger? Tell them to start writing about it. Exercise, physical health, taking deep breaths, music, talking to someone, counting slowly. It's about self-control and finding positive ways to cope with that impulse. We want to empower our children and give them permission to answer questions as they feel comfortable. People will ask them about what's going on. So we want to discuss questions they may get asked. We want to role play with them. How do they respond? And like I mentioned before, talk to your child's teacher. Let them know what's going on. Additional tips: you are the expert on your family. So you know how you're the expert on your children. You know them better than anybody. Provide timely and honest information. If it is a cancer diagnosis, use the word cancer. Age-appropriate language, routines and consistency, and allowing time for play. Young children especially cannot sit down and have long conversations. Let them play, let them be a kid, let them enjoy things. That's normal. Check in with them about how they're doing, ask open-ended questions, and then monitor changes in their mood and their behavior and in their school performance. Here's some just quick ideas to stay engaged as a family. So you may not be able to go out, you may not be able to do everything that you used to do, but some, things that you can do as a family to remain connected. Have a game night, a movie night, themed dinners, read the same book, art projects, whatever it is that you can do, that you have the energy to do, that you can remain involved and engaged with your family. And then here's just a list of resources. There's, educational resources, the American Brain Tumor Association, obviously, American Cancer Society, the one-on-one peer support that I talked about and mentioned. There's several matching programs that you can look at. There's resources in your community that you can connect to. You can connect with a local counselor, either by finding one on your own or by contacting your insurance or your primary care physician and asking for a referral. For caregivers, there's resources out there for you as well that you can contact, find that peer support, but also things, such as respite care, giving you information on caregiving, how you can find someone to step in when you need a break. And then there's some MD Anderson specific resources out there as well, since that is where, I work. We've got support groups in the social work department, psychiatry, supportive care, integrative medicine. So there's a lot of resources out there. This is not something that you have to deal with on your own. This is not something that you have to deal with just within your family system. There are resources out there, and I encourage you to find and connect to those resources if you feel like you need additional support. Attending these webinars is a wonderful way to stay connected, to educate yourself so that you can recognize maybe some warning signs or things that you may not have noticed or realized before that may just spark a little something saying, you know what, maybe I need to reach out. Maybe I need to find a little bit of help. So I encourage you to continue coming to these webinars, to continue finding ways to connect with each other and to find those support services that you're in need of. Okay, and that is the end of my presentation. Thank you guys so much for listening. I hope that you found it helpful and relevant information. We will open it up to any questions.
Thank you so much, Melanie. Just as a reminder, if you have a question that you'd like to ask, please type and submit it using the Q&A box at the bottom of your control panel, and we'll answer questions as time allows. So Melanie, one of the first questions we have here is referring to how some patients may experience personality changes as a result of their tumor or the treatments that they're undergoing. These changes can be very distressing to loved ones. Their patient may seem very different. Do you have any advice on loved ones on how they can cope with these changes?
Yeah, so personality changes are one of the hardest things to deal with. You as their loved one might, find yourself thinking, this is not the same person. And so how do you deal with that? I think that finding someone that you can talk to outside of that relationship is important. So whether it's finding peer support or counseling, but going and talking to somebody about what you're experiencing, but then also communicating with the patient and letting them know that finding new ways to connect. So they may not have the same personality, but if you can connect with them in a different way, trying to maintain that relationship as much as possible.
Thank you so much for that advice. You had mentioned some wonderful interventions that patients and caregivers can engage in for self-care. Do you have any interventions that you might recommend for children as they're coping with issues such as fear for their parent or their loved one that's going through the diagnosis?
Absolutely. So we use meditation a lot for children as well. I think it allows them to be able to really kind of put themselves in a safe place. And as if you can find someone who can guide them through a meditation like that. But there's a lot of different things you can do about learning and discussing their feelings, being able to identify those feelings. We use a activity called our safe box, and we put feeling facts in this box. We let the kids decorate them however they want to, and then they write down feelings of, I felt scared when my mom went to the doctor. They put that feeling fact in their box, and then they can shut their box. And we tell them that those feelings are in a safe place, that they can't stay there forever. You have to talk about them. So then as a family, you set aside a time to open their box and pull out their feeling facts and read them aloud and then talk to them about their feelings.
That's great advice. Thank you so much for sharing that. Another question we have here is, sometimes when patients are going through this experience, they really share the decision-making with their loved one and their caregivers, their family members. Can you share advice on how to handle issues when there are differences in opinions on what treatments to choose or what decisions to make between the patient and the caregiver?
So it happens a lot. And the patients ultimately, as long as they have the cognitive ability, are going to be the decision makers. So they're going to be the ones that the medical teams are going to listen to as far as what treatments they're going to have. Now, if there's conflict between a patient and a caregiver, whether the patient, we see it where the patient doesn't want to continue treatment and maybe the caregivers want them to continue. As with everything else, my advice is open communication. Sit down and have a family meeting about why they either want to or don't want to, and why the caregiver has an opposing view. If you feel like that needs to happen with a medical team present, you can always ask for a family conference so that the provider can be there as well and that they can answer any medical questions. But communication is going to be the key. You have to have open communication and discuss what is going on behind those decisions. And then ultimately, you may not agree with it, but at least you've had the communication about what is going on and you may understand them a little better.
And keeping up with the topic of decision-making, what about those patients who might not have a strong support system? They don't have caregivers or friends that they can lean on for help, yet they're disagreeing with their physicians and providers about what treatments they want to go through with. How can they handle those disagreements and those differences? How best can they bring that up with their provider and address that?
Yeah, so if you don't have the support system and you're the one going into those appointments and you're disagreeing with your physicians, I would recommend, asking them for a longer appointment slot if they have it. Physicians try to get in and out and see people quickly. But if you really have a lot of questions or a lot of disagreements, then asking for that longer time. And then also asking to involve, whether it's a social worker who's there on site or a patient advocate or someone else on the team that you can involve in that meeting to help advocate for you as the patient, to really fully understand what's going on and to be able to effectively communicate your wishes to the physician.
Thank you so much. Another question we have is, sometimes family and friends might not always react positively to a diagnosis, and they may distance themselves or abandon the patient. What advice do you have for patients that are dealing with that? It can be very distressing. How can they cope with the loss of relationships due to a diagnosis like this?
Yeah, it can be very isolating. The diagnosis in and of itself is isolating. And then when family members or friends don't know how to cope with the diagnosis, they may distance themselves out of their own feelings of discomfort. And as the patient experiencing that, it's another loss that you have to deal with. It's another loss that you're going to grieve. And what I would encourage you to do is find other avenues of support. Find those informal supports, whether it's a support group, whether it's a peer matching program. Find people who are going to support you during this. It may not be someone you've ever met. It may be someone that you only speak to online or through email. But finding those support systems is really important so that you're not going through this alone.
Great. Thank you so much for that advice. Another question we have is regarding some of the techniques that you shared during the presentation. You talked about meditation, mindfulness, breathing exercises. Do you know where patients or families can turn to find resources on how to engage in these techniques?
Yes, so there are several apps, if you have a smartphone, that you can use. There's an app called Insight Timer that has guided meditations on it. There's a website called mindful.org, which has a length of guided meditations that you can follow. And then it has audio recordings too, so that you can pull it up and play, and it guides you through that. There's a lot of information online about guided meditation, relaxation techniques. If you don't have access to the internet and you need some of that information, I would reach out to your medical teams or see if there's a social worker that you can contact who can give you some more information on that. But there's a whole range of just 5-minute quick breathing exercises, all the way through, 30-minute full guided meditations that you can engage in. So it's really just you find what's going to work for you and what you have the time for.
Great, thank you so much. During your presentation, you also mentioned how important it is to be able to ask for help and support when you need it. What advice can you provide for patients and families who may struggle with asking for help? Sometimes they can have that social anxiety of not wanting to ask or seem overbearing. What advice can you provide for those individuals who don't know how to bring up their concerns and needs to their loved ones?
Absolutely, and that's really common. It's really difficult to ask for help. When you've been independent, you do everything on your own, and then all of a sudden you're put in a situation where you're going to need help from other people. What I would suggest is, to start with something simple. If you're going to be asking for help, just to kind of get you into the habit of asking for help. So whether it's, letting someone send you a meal on one day a week, start with something simple that lets you kind of practice asking for help. And then just reminding yourself that these people are your family, they're your friends, they are wanting to help most likely, and they don't know how. And from what we hear from caregivers and families, is they are so happy when they're told what they can do to help. So if you have a list of things that you need help with, ask them for it, as uncomfortable as it may be. And I will say that you'll get more comfortable with it the more that you do it.
Thank you so much. Another question we have is really relevant to what's happening now with a lot of children who are having remote schooling. For patients, that can be challenging for patients who are parents, as they might not be feeling too well to help and support their child as going through these Zoom classes. Do you know of resources that provide childcare support for people who might not have support from other family members or friends that can help with their kids?
Yeah, and it's really a struggle right now because of COVID. It's really created some issues with some resources being available. I know that there have been places and daycares even that have opened their doors and created learning spaces for kids who are going to virtual school. So they actually come to a place like a gym and they get set up and they do their virtual school there so that there are people there monitoring so that you as the parent aren't having to help them through those tasks as they go through them every day. I would reach out to your school districts and ask them if they're aware of any of those resources available in your area.
Wonderful, thank you. Another question we have is for caregivers who are supporting their loved one from a distance. They might not live in the same town or the same state as the patient. Do you have any advice for how they can provide better support for their loved one even when they can't be there physically?
Yeah, so the main thing is stay connected. However it is, whether it's through phone calls, whether it's through, FaceTime, video calls, sending them cards in the mail, but staying connected, checking in with them, asking how they're doing, seeing if there's something that you can do remotely to help. Maybe it's arranging for a meal delivery service. Maybe it's setting up a GoFundMe account or a Caring Bridge or, one of those online forums. You can do that from, wherever you are. So maybe you take that on as the caregiver and you have that task. But finding ways that you can do that, take something off of their plate remotely, and then just maintaining that relationship and checking in with them.
That's great advice. Thank you. And I think we have time for maybe one more question. This question is referring to seeking professional mental health support. How or when is it appropriate for a patient or a caregiver to reach out for mental health support? How can they determine for themselves that the social support they're receiving isn't enough and they may need extra help?
My thought is it is appropriate anytime. It's appropriate anytime for you to seek professional counseling. And whether or not you have great support systems or you don't have a support system at all, it's still appropriate for you to find that professional support. It's going to be a different kind of emotional support than you get from your family and friends. So I would say if you want it, reach out for it and get it. If you feel that you're struggling or you just feel like you want someone else to talk to, you want an unbiased person to listen to what you're going through, it's appropriate anytime. There's no right time to find counseling. Just do it.
Thank you so much, Melanie. That is all the time that we have for questions for today. Thank you all for your wonderful questions. And thank you, Melanie, for your wonderful presentation and all of your insight and advice. Aside from our educational webinar series, the ABTA has a variety of programs that help support patients and caregivers throughout their experience. For more information about these services, please call the ABTA Care Line at 1-800-886-2282 or email us at info@abta.org.